Hello everyone. Hi. How are you today? Well, hi. Just let me introduce myself first. My name is Kevin, and I'm a acupuncturist from Center Balance, and just doing a regular live talk show about different medical issues. For example, yesterday I talked about lower backache. And today I'm going to introduce you to the world of headache. So I'm pretty sure many people experiences headaches. And so we'll be discussing about the views, Western perspective, Western medical perspective, and Chinese medicine perspective on the topic headache. All right, so we'll get started. So let me introduce you to the Western medicine perspective of headache. So what are some of the headaches that we talk about in Western medicine? It can actually be divided into two types of headaches. You have what we call a primary headache, which is mainly caused by change to the blood vessel, nerves, or chemical in the brain. And then you have the secondary headaches that are caused by another condition such as infection or head injury. So these are the two main types of headaches. You have primary and then you have secondary. Okay. So the symptoms will determine what type of headache that you are experiencing. Okay, so for primary headaches, there are a few different types. So the most common one is probably what we call tension headache. Tension headaches comes in two types. One is a episodic tension headache, and the other one is called the chronic tension headache. So episodic tension headache lasts from anywhere from 30 minutes to about a week. They occur less than 15 days a month. Okay, whereas chronic tension headache can last for hours and happen more than 15 times a month, 15 days a month. Okay. So the tight muscles in the neck and head can set off tension headaches, stress, and then you have, so the broadcast just stopped for a second, so continue there. So then there's another type of primary headache, it's called a migraine. It's unlike a traditional headache. Migraine can cause more than just a headache, head pain. Some people experience migraine from time to time, while others get them several days each month. Overall, women are more likely to develop migraines than men. I'm sorry, ladies, that's just how it is. And so what migraine feels like, it's mainly a throbbing pain on the side of the head, okay? Sometimes accompanied by nausea and vomiting. And sometimes movement, light, and sound may make the pain worse. Then you have another type of primary headache is migraine with aura. So aura just means that you'll be seeing sparks, flashes of lights prior to the onset of headache, maybe an hour before the migraine starts. Okay. Then, okay, so that sums up the Western perspective on primary headaches. So let's go into secondary headaches. Excuse me there. So secondary headaches are often caused by minor head injuries or medication overuse. They are also associated with underlying medical conditions such as high blood pressure, infection of the brain or head, such as meningitis or sinusitis, bleeding or swelling of blood vessels in the brain, fluid buildup in the brain, also known as hydrocephalus, or brain tumor. So these things can cause secondary headaches. Unlike primary headaches, secondary headaches come on quick. They can be very severe. Okay. Different types of secondary headaches includes external compression headaches. So these headaches are occurs more commonly in people who often wear helmets and goggles, such as military members of police officer. So they often start after you've worn something tight around your head, like a helmet or goggles. They are also sometimes called football helmet or swimming goggle headaches. Okay, and how it feels if the pain goes away within an hour after you remove the object, or most of the time. Then you have rebound headache. That's another type of secondary headache. So these headaches affect people who often use pain relievers to treat migraines. So overuse of these medicine can cause withdrawals, which leads to more headaches, unfortunately. So these are also called medication overuse headaches. So the drugs that can cause rebound headaches includes acetaminophen, NSAIDs such as ibuprofen, what else? Over-the-counter headaches remedy that contains caffeine, migraine drugs such as triptans and ergotamine, I'm not quite sure how to pronounce that, and then narcotics such as codeine. Okay, and drinking coffee or other caffeinated beverages daily can also lead to rebound headaches. Okay. Then there's another type of secondary headache which is called a sinus headache. So these are triggered by blocked sinus with pressure building up in the sinus area. What else? And then you have spinal headache. This is caused by fluid leaking from the main brain around the spinal cord. And the fluid loss lowers the pressure around the brain. Okay. So then you have thunderclaps headache. These are quite rare headaches that comes on quickly and intensely, like a bolt of thunder. They aren't any obvious triggers for the pain. Okay. Okay, so that sums up the perspective of the Western medicine's headaches. Okay, and that's going to how Chinese medicine sees headache. Okay, so in Chinese medicine perspective, there are two types of headaches as well. So one is caused by invasion of external pathogenic evils. Okay, so what do I mean by these? So there are 5 different pathogenic evils that can invade the body. We call them wind, heat, wind, summer heat, dampness, and dryness, and cold. So these in a negative way. Okay, so my other connection is breaking up a bit. That's why I'm, pausing a bit. Okay, so so the most common type of pathogenic invasion is through the bladder meridian. I'll show you why. Okay, so as you can see on this model of a female body. So you can see the meridian lines that are going along the body, okay, all the way to the feet and on the back as well. So you see the bladder meridians are actually running, if I hold it closely, it's actually running from the foot up, okay, all the way, and it becomes a few different channels, and then all the way up, carries to the forehead, and then to the top of the eye, okay? So because the bladder meridian in Chinese medicine, it encompasses such a wide area, it's most prone to invasion of external evils or external pathogenic factors. Okay, so when you have a headache that caused by external evil invading the bladder meridian, then the most common symptoms are like tightness around the neck, or pain that goes from the shoulder all the way up to the head. Okay? And then, of course, there are other routes of pathogenic evil that can invade the body, not just the bladder meridian. And you have like stomach meridian, you have the gallbladder meridian, you have the kidney meridians. So I won't go too much in details because it's going to take forever to explain them. The next one I'm going to talk about is the other route, the other cause of headaches. So what we just talked about was external pathogenic evils from our environment invading the body, causing headache. And then now the second type of headache, of course, for headaches is internal imbalance that causes headaches. Okay, so these are more commonly caused by what do you call chronic illnesses that prolong lagging there. Okay. So after you have chronic illness that hasn't been treated or has been there for a long time, it will naturally make your body weaker because it consumes a lot of energy to deal with the chronic illness. The longer it's there, the more it's going to make you deficient in qi and blood and all the other things that, yeah, okay? So when that happens, the qi and blood in the body is not sufficient. And then, so if you imagine, if you turn on the hose to full, all right, and then you have a hose, the water will come spraying out very quickly because it's very strong, the flow is very strong. So when you turn down the hose, the water flow becomes slows down, it doesn't burst out like before, and then start to trickle once you close it, you turn it off more. So our body's like that. When it's strong, the blood flow, the qi flow is very, very powerful. You can, like it's how it should be. It's, healthy body. The qi flow and blood flow is very good. But as you have problems in your body, a chronic illness, your body becomes weaker, it consumes your energy. So the qi and blood start to flow slower and slower and slower until it doesn't actually go through. And when the blockage forms, that's when you have pain and discomfort. So that's why we say chronic illnesses is the cause of many, many pains and discomfort in the body. Okay? In this case, we're talking about headache. Okay? Okay, some people may some people who prefers fatty foods or very flavorsome food, or like for example very salty food, or they eat a lot during the meal, during each meal, that can result in injury in the spleen and stomach. Okay, so you're causing the spleen and stomach to overwork, and then over time it becomes weaker. So as a result, the stomach and spleen cannot get rid of excessive dampness and phlegm that's created. So as a result, the dampness and phlegm accumulates in the body and forms blockages. And that's why some people have pain in the head, okay? The other reason might be because, okay, comes back, or low mood, depression, yeah, and that can actually also cause the meridians to be blocked over time. So, and as a result, headaches appears. Okay, anger can also be a trigger. If you're angry all the time, or you're very angry, sometimes people get a headache as well. Yeah. Okay, and when you have a headache that's related to emotions, that's related to emotions. That is, we also say that is connected to your liver and gallbladder, because on this chart, as you can see, that liver and gallbladder, they actually governs emotions, as you can see. It governs anger, depression, irritability, stress, and impatience. So through that, we can also diagnose as a liver and gallbladder imbalance or blockage in the liver and gallbladder meridian. So that's how we also look at it. Okay? And then there's another different type of cause is caused by deficiency. Okay, internal deficiency. For example, blood and qi deficiency, or essence deficiency. Okay, that can be either during when you're in the womb, you weren't nourished, you weren't fed enough, or nurtured enough, and so you have deficiency when you're born, or the deficiency can come after you were born through stress and overwork, and things such as those. Okay, or if you have a chronic illness, or after you've given birth, or in a injury that causes excessive blood loss, these can all cause deficiencies. Okay, or some people are in the third world country, they have like not enough food. That can also be the cause of deficiency. Okay, so when that happens, headache can appear. That is what we call a deficiency headache. Okay, and how do we tell if it's a deficiency headache? Posture, the demeanor, the way they answer you. If they are answering like in a very low tone voice like this, they're not talking with a lot of power. You can't hardly hear them. The voice is always low. Or if their face is really pale without luster, or if they often complain to have pain behind the knees, or have wet dreams, or those kind of things. Then we can think, well, okay, this person's probably deficient in some area. The last one, but not to be overlooked, is external injuries. Okay, so for example, if you had trauma, okay, like a in a car accident or a ball hit your head, that can also cause headache because trauma causes blockages. As you can see, if you get hit with a baseball in the arm, it starts to swell up, and then after some time, you start to see bruising, like a purple bruise. That is a sign that it's saying the blood cannot get through. Okay, so when you have blockages, then you have pain. All right. So that is the Chinese medicine perspective on headache. What else? We also can diagnose headaches through just looking at the meridian. For example, say if the headaches is appearing on the forehead, because the forehead has okay, so when it happens in the forehead, it's what we call a stomach meridian headache. Or if it's on the top of the head, then we say it's caused by a liver, okay, liver meridian, or associate, or not caused by liver meridian, but associated with the blockages in the liver meridian or the stomach meridian. So the front, if you have a frontal headache, it's caused by the stomach. It's associated with the stomach meridian. If you have a vortex, what do you call it? The top of the head headache, then we say this is associated with liver. If it's on the side, we say that is associated with the gallbladder meridian. And if it's on the back, as I said before, the bladder meridian runs along onto the top of the head. So this is mainly associated with the bladder meridian. Okay, so that's another way we diagnose patient. Okay, so how are we going to treat the headache? Are we going to look at the different illness history? Has any trauma or injury happened to them in the past? Or has the weather, the external pathogenic evils invaded the body? That's how we look at how we form up a diagnosis for our patients. Okay. So I'm going to pause now and let anybody who has a question to ask that question. So if you're watching and you have a question, please don't hesitate to ask me. Okay, anything about headaches, all right? So I'll give you a couple minutes to think about it. All right. If there's no questions for now, that's all right. If you have any questions that comes up later, you can always give us a call. We are Center of Balance, and my name is Kevin. You're acupuncturist, so you can reach me on 0800 number, 0800 221 224, or you can call 07846 7956, or you can just come in for a visit and have a chat with us. Our staff here are very friendly. The clinics, the acupuncturist and Chinese medicine herbalists, they're all very professional and friendly. So our address is at 27F Fata Fata Road, Dinsdale, just inside the shopping complex. All right, And this is it for me, and I'll see you next time.